Now moving over to the next fracture. On one side, if you can see, we have a green stick fracture. On the other side, we have a nightstick fracture. First of all, where does this word green stick comes from? The property of a green stick is its elasticity. And that is a property of a green stick, that no matter how hard you try, you cannot completely break it into two parts. You can bend it. You can bend it into any degree. You can bend it into any way, any degree, but you can't completely break it into two parts. So this is the most common fracture seen in children. Green stick fracture is the most common fracture seen in children overall, that you have to remember. Now this green stick fracture has to be in the diaphyseal area, it has to be in the shaft, it has to be in radius more than ulna, and there has to be a concave or convex deformity. While on the other hand, if I see a torus fracture, also what is called as buccal fracture. I call it a torus fracture or buccal fracture. So if you see, this is diaphyseal, this is metaphyseal, this is concave or convex, there is no concave or convex, radius more than ulna. Usually in torus you see involvement of radius. Both the fractures are classically seen in children. Are you getting my point? Both the fractures are classically seen in children, but please try to understand that green stick is more commonly seen as compared to torus. Green stick is more commonly seen clinically as compared to torus. Do we get this? Now the next thing is, I would like to express the same thing with the help of an X-ray. So you can see that there is a bend in one of the cortex, and you can see that there is a break in another cortex. So that makes it unicortical. That makes it incomplete. Okay, so that makes it unicortical, that makes it incomplete. And you can see that radius is more commonly involved as compared to ulna. Now you can see the shape of the forearm. So if you see the shape of the forearm, then there is for sure a concavo-convex deformity. For sure there is a concavo-convex deformity. Are you able to understand this?